In terms of what's been very interesting in the research, and I don't think people know about this, something so important is protein, is getting enough protein. Because years ago they felt, oh, these high protein diets or too much protein is going to cause calcium to be leached from the bone. But it's just the opposite. The research now shows we need enough protein, and we need more than the RDA, the recommended dietary allowance, what they say. And so, they've done research on this, and the people that have increased in the studies bone density have had more, they have higher levels. And one formula, there's a couple you can use, but you can just take your body weight, divide by 0.5. That was one that they used in some of the research studies. So, but it's more than the RDA. And a lot of times people aren't getting the protein, especially as they get older. So just very important to make sure you get good quality. I'm big into organic, grass-fed, and wild. And, if it's a protein powder, have it organic. And, whether it's vegetarian or whether it's not. But the key is the quality and getting enough protein. That's found to be very, very important. Besides that, the one that everybody worries about and the big thing everybody is so concerned about is calcium. Problem I've found is that people are getting too much calcium because, their whole life they're like, drink milk, do this, do that. Plus, then the doctor says, oh, okay, take a calcium supplement. Well, more is not better. And so in the United States, they recommend anyone over 50 gets 1,200 milligrams. In other countries, it's less. But and so what happens is people are getting some in their diet. They're taking more, let's say they take 1,200 milligrams as a supplement. They're getting too much. And there have been some research, not conclusive, but showing that this extra calcium isn't good. It goes places we don't want, as the arteries or kidney stones. And so we don't want too much.
Is that truly a function of too high of calcium intake, or is it more a function of calcium intake in an imbalanced way relative to some of the fat soluble vitamins, vitamin D and K and A, and other minerals like magnesium and zinc and things like that? If you're just taking calcium supplements in a way that's not in harmony with those other nutrients, like would be common in the context of getting calcium from your diet. But if you're taking it in a supplementary way as isolated calcium, is that the main issue, or do you really feel like it's just too much calcium overall?
No, I completely agree with you, but that's never been studied. That's my exact feeling, exactly what you said. That's such a very good point, because most doctors will tell people take calcium, and they do check your vitamin D level. Most of the doctors will look at vitamin D, and depending on what it is, have you, increase your vitamin D. However, what they don't put in is that vitamin K2, and vitamin K2 takes that calcium and makes sure it goes into the bones and sweeps it out of the soft tissue. So I think that's something that's really missing. Now, you can get K2 in some food. There's a Japanese food called natto, and people that, in those parts of Japan where they had natto, they have significantly reduced incidence of osteoporosis and fractures. But most people, it's pretty slimy. It's not that tasty. Most people can't get enough from their food. So it's a supplement that I recommend pretty much for almost everybody.
Mm-hmm.
But yes, you have to, and the magnesium, it's very important, that you have the whole orchestra so that you can absorb the calcium, but still you don't want high doses of calcium. There's no reason to people. And again, we don't know because they don't, the research, there were just studies that had showed some cardiac issues and other things when people were taking too many calcium supplements, like high dose calcium supplements.
Mm-hmm.
So, but again, it's not 100% conclusive. But even the Bone Health and Osteoporosis Foundation says get it from your food and only take a supplement if you're not getting enough in your food. So it's always food first with calcium, but we need those other nutrients. You need the entire symphony of nutrients. But the K2 is one that's missing, and I think it's absolutely critical.
And so what does K2 do? I think for people unfamiliar with this topic, it will be extremely important to understand the role of K2, vitamin K more broadly, but K2 especially. And also in light of the fact that many people, particularly in this COVID era, are using high dose vitamin D. So what is the role of vitamin D in terms of bone health, and what is the role of vitamin K in bone health?
Okay, well, vitamin D helps with the absorption of calcium, just to make it simple. And so, it's a complex situation with vitamin D and your parathyroid, but basically it increases calcium absorption. So we need the vitamin D. The vitamin K2 there's two proteins. There's osteocalcin. It activates. So it activates osteocalcin. And what that does, the osteocalcin makes sure the calcium goes into the bone. So that's part one. Part two is it activates something called GLA matrix. And what that does, that protein, that takes the calcium, sweeps it out of the soft tissue, places it shouldn't be, so that it's not. And so together, it's doing just what we don't want to have. It's preventing calcium. It's making sure the calcium gets where it needs to go, as well as getting it out of the soft tissue. And there's two types. There's a MK4 and an MK7. And there is some controversy, like what's better. And I have this summit happening, and the doctors give different. A lot of people talk about this K2 because it's so very important. But there's research on the MK4 showing significant reduction in fractures. And that's very important to focus on, instead of like, what's your bone density? Is this reducing fractures? Because that's what we're so worried about. And so the study of the MK4, which is the problem. MK4 is a much shorter half-life, so it doesn't last very long in your body. So it's a little harder to take on a regular basis. The studies showed 45 milligrams taken, so it has such a short half-life for it to be in your system. You need to take it like 15 milligrams, like 3 times a day, ideally. Versus the MK7 has a much longer half-life, a few days. So it's much easier to take. But the MK4 has shown the fracture reduction. The MK7 has shown reduction in bone density. And it's not that it hasn't shown fracture reduction. They just haven't done the same studies or used it for the same. So both are good. My feeling is that, a lot of the doctors, people recommend both. You can do both as well. And so, but they're both good. The point is, you need the K2. Now, a lot of people confuse it with K1. K1 you'll get in your leafy greens. And most people, if they're eating a good diet, will get enough K1. But K1 is also involved in blood clotting. So oftentimes if someone's on Coumadin, or if they're on some type of blood thinner, you really need to talk to your doctor before you increase K1. And so K1, they haven't really found, it's not the same as K2, but it's still good. And some studies early on showed, people who had more lettuce, or in different studies who had more K1, didn't have more bone density, but they had more, they had more flexibility. So if they fell, they didn't fracture. So it's all important, but the K2 is that one that I think is so critical. And so many of the experts on the summit make a very big deal that that's a huge part of their program in terms of people who have been dealing on an integrative approach with osteoporosis. Dr. Millman, Dr. Newsat, they both feel that, and they both have been using MK4. Now, Dr. Millman is saying she's open more to K2 because they're, MK7 as well, because they're doing more research. So anyway, yeah, long answer for it, but I think it's so important, and something that for some reason, conventional doctors, I don't know why, because there is research on it, we'll just tell people D, calcium, and they'll say exercise, but they're not specific in what type of exercise. And
that's a very big problem, to just say take vitamin D and calcium and do exercise without getting specific. So we're going to get there in a second. I want to touch on nutrients a little bit longer. So let me ask you this. Are there any nutrients of great importance beyond vitamin D and K and calcium?
Well, magnesium, I think, is very important. Magnesium also helps get into the bones. And in terms of the bone matrix, we talked about protein, but so the calcium is embedded in this bone matrix. But what makes that bone matrix, what's important, is the protein, but vitamin C as well. So I think vitamin C is an important nutrient. I also think collagen can be helpful for people, because whether they get it from bone broth or take collagen. But there's boron, there's zinc, there's biotin, there's like a whole Folate's important. So I think if you're eating a good diet, I personally have people get a micronutrient panel because I think it's so, when people want to do everything they can do, I'm a big believer in test, don't guess. So I want to see what's lacking, what's lacking in their diet. What are they not having? So really, all of those things can affect boron, all of those things can affect the bones. But again, the same in terms of the research, the ones that have been shown are the K2, really, in the calcium and the vitamin D. Even the magnesium hasn't been shown exactly to correlate, but we know it's important. We know it has so many functions. So, yeah. So in terms of, that's what I like to do. I like to have people get a micronutrient test, and so we can see what's missing in terms of their diet, because a lot of times things are.
Are there any foods that you would consider bone health superfoods?
Yeah. So I like the greens. The leafy greens to me are superfoods. And so, for example, collards, collards have like 265 milligrams of calcium. They also have magnesium. They're packed with many nutrients. So you're getting a lot of, you're getting a lot when you're having the collards. And a lot of people, that's not part of their diet, collard greens. But you can use it as a wrap, just steam it and put it around like a turkey burger or a bean burger, or you can saute it as well. But it's a great wrap in terms of putting all sorts of things in it. So I love the leafy greens. I like collards. Bok choy is also one that's high in calcium. I think that has like around 150 milligrams. That's another good one. Kale is also very good. It's high in calcium as well. They have so many other components with the magnesium, and there's just many things when you take the leafy greens. What is interesting though is that with oxalates like spinach, some people think spinach is a great food for the bones. Well, it's not, because it's high in oxalates, and oxalic acid combines with calcium to make it an indigestible compound. So you're not going to get the calcium from that. It becomes indigestible. And there's even animal studies now that are showing that with the oxalates, it even binds to additional things to reduce the calcium. So you have to be careful not to have a diet very high in oxalates. And, sometimes people, can't have dairy, which a lot of people, for a lot of people, as it's very inflammatory. And so they, have very high doses of almond milk and different things. And, that could be high oxalate as well. So you have to just be careful.
And some of the alternative milks have carrageenan in them as well.
Yes,
Very inflammatory for the gut as well.
exactly. And so some other food, though, I love sardines, sardines. And I always like to get the wild kinds from a good source. But sardines are great because they're high in calcium as well as protein. Wild caught salmon is good as well. So there's lots of things that are good in terms of nutrients, are high in calcium, and they're also beneficial for other reasons as well. Yeah. So I'd say those are some of my top favorites.
Great. You touched on dairy briefly a couple times so far. What exactly are your thoughts on dairy, particularly given the sort of obvious relevance to this topic, given how much dairy and milk consumption has been advertised for strong bones over many decades, and obviously we have that, and then on the other side we have people in the vegan camp who are saying, actually, they'll cite studies saying dairy consumption actually led to weaker bones, and that all these studies over here that showed positive outcomes were funded by the dairy industry and are therefore bad science. What, sort of seeing through these different kinds of either financial agendas or dietary dogma sort of driven takes on things, what is your perception of the scientific evidence on that topic?
Well, the interesting thing, with dairy, I grew up in the milk in the milk mustache, where every athlete was, showing the milk mustache. And you're right, like you must have your milk for strong bones. Well, they found in countries, there's data that countries that have the most dairy consumption have the greatest incidence of osteoporosis. So that certainly is not, it's not a panacea, and it's not something that is.
There could be a very obvious confounding variable there, which is that, what those countries are, I would guess, would be the United States, and probably some other modernized, westernized countries that have consumed a lot of dairy milk. And those countries tend to also be the ones that are more sedentary and eating a highly processed food diet and, deficient in some of the nutrients that we're talking about. And so I would see that as a confounding variable. Are there any interventional studies where they've maybe put people in high or low dairy consumption, maybe even women who already have osteoporosis, who are 60 plus years old, and you consume lots of dairy, you consume very little, let's compare 5 years from now? Any studies like that?
Not great studies, nothing conclusive to that extent. And so, I mean, there have been times where they said there were some positive effects from dairy, in terms of in the past, and cheese and things like that, and yogurt seem to have better results. So my take on the whole thing is certain people, and I see this a lot, dairy is inflammatory. And again, you can get tested also and see, but people know. So if you're having full-fledged inflammation, many people have issues with the casein. Many people have issues with the lactose, they're intolerant. So I see this a lot. So if it's causing inflammation, it's not going to be something that's going to be helpful for your bones, because the inflammation is something that affects, there's the osteoblasts and the osteoclasts, and inflammation increases the activity of the osteoclast, the cells that actually break down bone. So in that sense, the dairy is something that, for that person, in terms, if it's inflammatory, which I see a lot, I see that tremendous amount, so that would not be good for that person. For some people, sure, they can tolerate some dairy, but it has to be good quality, as well as, as well as I do, that the regular dairy that's not organic has so many hormones in it, and there's so many chemicals, and it's really unfortunate. So if people are having dairy, I always want them to have dairy that is organic, that's from the pasture, and good quality. And so there's not an actual answer in terms of like great studies that showed, yes, the benefits of dairy outweigh the negative, because they are inconclusive, and we do need calcium, we know that, but we haven't found that dairy really is the answer. And I know I've talked to a lot of pediatricians, and there's pediatricians I'm doing on my summit coming up, and there's a pediatrician as well, and they see that it's so inflammatory for so many of their kids. And so in terms, they have to find other ways to get the calcium, because it's so important for your bones, and not the dairy. So again, most of the people can't, again, some can, but I see a huge problem that for many people it causes inflammation, which we don't want.
Mm-hmm. Okay, before we run out of time, I want to make sure that we get into one of the most important topics, which is movement and physical activity, exercise. I would argue, and I suspect you would agree with me, that even if you had the most perfect diet for bone health, even if you completely eliminated your psychological stress and were the happiest person in the world, if you did not subject your bones to lots of physical stress, physical forces acting on them, creating stress, creating tension and pressure, that you would still have very weak bones. You need this physical stress present in order for your bones to have the stimulus to remain dense, to build density, and to retain their density. Would you agree with that?
Absolutely. And that was very well said. And you can just look at the astronauts, they've looked at astronauts, and that's a big part of the research that they've done at NASA. And they found that, yeah, they lose significant bone because they don't have the forces, they don't have gravity, they don't have the forces placed upon it. And as I said, with bed rest, people are losing almost 1% of their bone per week in studies. So it absolutely, this exercise is a huge, huge component.
And this gets into something that is my biggest area of focus and passion right now. This is the subject matter of my next book on hormetic stress, and this is one example of it. How subjecting the body to stress not only creates positive adaptations that confer health benefits, but is actually necessary, is required for normal healthy expression. Our biology is designed to require certain stressors in adequate amounts consistently in order just to be normal. In other words, living in an environment that has a deficit of those kinds of stressors creates abnormal cell and tissue function. And this is a great example of it with physical forces acting on the bones. So let's get specific, because we were mentioning how it's a problem that doctors don't get specific on this. So you tell me specifically, what types of exercise are the best for bone density?
Yeah, because it's interesting, because doctors will say, well, walk. Well, yes, walking has been shown to reduce hip fractures, and its balance is so important to produce fractures, but it doesn't actually increase bone density. It's really not enough. So what they found that's enough is impact. And again, that depending on how what the level of osteoporosis is, you may change this. But for people, early on, or just to prevent strong bones, jumping causes more bone to be produced, because that's the force against gravity, so jumping, anything where we're getting impact on the bones. So now that's one. Or resistance training. Strength training is amazing. So when we're contracting a muscle against resistance, it's like, hey, we need more bone here. But they found it's not the repetitions, it's the actual force, it's the weight, so they'd rather do 8 to 10 repetitions. That's somewhat hard. They have this formula, and versus 50 repetitions is something easy. And you see that people are lifting 2 pounds forever. It's not going to be enough. Just like you said, you need to keep increasing the weight so that, it's not easy. Your body has to work against it, and that's how it gets stronger. So strength training at least twice a week has been shown in the research to increase bone density at any age. They did a study called the Liftmore study, where they had people who had osteoporosis. This was supervised. I wouldn't suggest people look at those exercises and do it themselves, but they did show, all ages increasing bone density, people that even had fractures in the past and osteoporosis. So the point is, yes, you can, but so resistance training, strength training at least twice a week. And then weight bearing, whether it's dancing, jogging, whether you're getting the jumping, even in people, if they jumped, they had studies showing just jumping a few times, just people jumping every day, a little bit of jumping increased bone density. So it's just important, for young people to play, to jump rope, to do things at all ages. And, even young mothers get so busy in their life, they don't do these things, and they're not getting the forces on their bones. And it's not that hard to start a strength training program at any age, and impact. So even, high intensity, different types of impact training is good, but the research is the strength training as well as the impact and the weight bearing. So those are the 2 types of exercises that are most important. And what I see typically is that people aren't doing enough weight. They'll do, they just they don't keep increasing the weight.
Women. Yeah.
Yes.
And I was a personal trainer for many, many years.
Oh, so this.
A
Yes.
lot of time in the gym, a lot of time training women. And it is extraordinarily common. I would say probably almost 99 out of 100 women who even, first of all, it's rare for a woman to even approach weight training and start that. It's becoming more common now than it was 10 or 20 years ago. But even among the women who sort of hear a message like the one that you are giving right now and sort of say, oh, well, maybe I'll start strength training, then it's common for them to really not understand what strength training really is. And also there's a common fear among women, I don't want to get too bulky. And let me put those fears to rest, because I can assure you it's quite difficult to put on muscle mass. If it was a problem that lots of people were waking up with too much muscle mass from doing a little bit of weight training and going, oh my gosh, I have too much muscle mass, this is a real problem. I would have run into this problem a long time ago, because I've been weight training for 25 years. In the absence of steroids, it takes a lot of work to put on muscle mass. It's very difficult. It's a very slow process. And apart from the rare extraordinarily genetically gifted person who might put it on easier than the norm. But women in general definitely do not put on muscle mass easy, and you do not get bulky by accident without busting your butt for years lifting heavy weights. So I just want to emphasize this to your point, to hopefully let women who are dealing with low bone density listening to this podcast know lifting weights is extremely important, and don't be afraid of pushing into heavier loads, challenging yourself to actually lift some weights that are relatively heavy for you. You know, don't injure yourself. Obviously, don't push beyond your capacity. Be slow and smart and systematic about how you begin and progress. But the idea is not to forever be lifting the 5-pound pink dumbbells, you know, on day one. And then a year from now, if I see you in the gym after a year's worth of workouts, if you're still lifting the 5-pound pink dumbbells, you're doing something terribly wrong. You're wasting your time, you know?
Yeah, I just want to say two things actually. So I couldn't agree with you more. I absolutely, you're right on the mark with that. And it is scary. So two things. Number one, it's so empowering. Strength training, and you've seen this, that if it's amazing when you increase your strength. I have 85-year-olds helping me move things because they've been doing it. So it's such a win-win situation. But anyone that does have low bone density or osteoporosis, there is one precaution you need to take. They've done studies showing that rounding and forward bending increases the risk of fractures, because right on the front of the vertebrae, on the front of the spine, is where fractures occur. And so you don't want to do any exercises that cause rounding. Not that you can't do everything, you just do it with modifications. And so you maintain, the inward curve, and you can do Pilates, you can do yoga, you can do everything just without doing the rounding. You're bending from the hips and knees, not the waist. And it's just, there's all sorts of things. But my recommendation is, and in the United, is to see a physical therapist. If you're scared, you get the diagnosis. It's covered. It's usually, at least in the United States, it's covered by insurance. So just ask your doctor to get a physical therapy consult for someone who works with osteoporosis. And they'll just make sure, because you want to do things safely, that your posture is good, that you're doing everything, and they'll get you started. And so you don't have the fear. And then you can do just what you said, Art. You can do those, the strength training, and the lifting is so powerful and so effective in increasing bone density. And you'll be older and you'll just be so active, and you'll be so happy that you did this.
As far as nutrition, I know you've mentioned some aspect of that, but is there anything you can speak to as far as the role of vitamin D and vitamin K in particular? I mean, modern diets in particular are commonly deficient in vitamin K. Most of the population is deficient in vitamin D, which is largely a result of sun deficiency, but also some aspect is nutritional as well. But what's the role of those two things in this picture?
Absolutely. Yeah. So vitamin D plays such a major role in not just bone health, our health in general, but it's one of the most important nutrients for overall health, well-being, bone health. It's not just a vitamin, right? It acts as this powerful hormone in our bodies. It induces the transcription of more than 50 genes. It's going to increase the intestinal absorption of calcium. It's promoting higher bone mineral density. It's lowering that fracture risk. It's helping us improve our muscle strength and decrease the risk for falls. And there's just so many benefits that come with vitamin D, right? Super, super important. And like you said, a lot of people aren't getting enough of it because of a lack of sun exposure, for one. And even if people do get sun exposure, maybe they're not getting that midday sunlight with UVB radiation, or maybe they're lathering up in sunscreen and they're not actually getting that exposure to their skin. They may be outside, but they're not actually getting that. So you need to make sure from dietary sources perspective, you can get vitamin D. Sun is going to be your best source of it. But you can get vitamin D from fatty fish, right? Salmon, herring, sardines, anchovies, oysters have some egg yolks, mushrooms have D2. But in terms of supplementation, that can also be helpful. But with supplementation with vitamin D, this is not a supplement that you just start taking blindly, right? You need to check your levels beforehand. And then as you start to take vitamin D, you need to monitor that every 3 to 6 months and see where your level's at, because you can get to a point where you have too much vitamin D. right? So if you are going and getting your 25 hydroxy vitamin D lab test, and you're looking at that, the range on that, if you're in the US, 30 to 100 NGML, that's a massively wide range, right? If you're at 100 or higher, that's too much, and it can actually contribute to bone loss if you're above that. But then if you're on the lower side, if you're around the 30s and lower, that's also going to contribute to bone loss. So we need to bump that up, get that higher than 40, 50, somewhere around there. Some people's needs may be higher than that. But right in that 40 to 80 range is going to be really, really important for most people.
Yeah.
And then vitamin K also. So a lot of people hear of vitamin K, but a lot of people don't understand there are different types of vitamin K, right? There's K1 and there's K2. K1 can be converted to K2, but not efficiently. K2 is what's most important for bone health. So vitamin K2 has a lot of different forms, but the major ones we hear about mostly are MK4 and MK7. MK4 has a really short half-life, stays in your blood like 4 to 8 hours, something like that. And it may require larger doses that are spread throughout the day, right? MK7 has a longer half-life, and that stays in the blood, or in the body, 2 to 3 days. The reason why K2 is so important is it's going to aid in bone mineralization and formation by activating something called osteocalcin. And what this is doing is it's ensuring that calcium is deposited in our bone and not our soft tissues like the arteries and the kidneys. So super, super important. So where can you get these from your diet? Dietary sources of K1, those are your dark green veggies, asparagus, your kale, your broccoli. K2, MK4, that would be things like beef liver, grass-fed ghee, butter, dark meat chicken, pastured egg yolks. Those are all great sources of MK4. And then MK7, K2, MK7, hard cheeses, fermented foods, sauerkraut, kimchi, natto, and bacterial fermentation in our guts. Okay, so you can also supplement the, actually, in Japan, there were some studies showing that 45 milligrams of vitamin MK4 is actually used as a treatment for osteoporosis. But you can supplement with MK7, MK4. Those can be helpful additions to your plan too.
Excellent. You mentioned earlier that there's sort of these two aspects of assessing your skeletal health: bone mineral density and what was the name? Bone quality.
Yeah, bone quality.
So as far as my understanding of physiology, and I'm certainly far from a bone expert, but we have osteoblasts, we have osteoclasts. Okay, so bone deposition, bone formation, and bone destruction. And what are the sort of key determinants of bone quality, though? What is actually determining if we're laying down bone in a high quality versus low quality way?
I would say, like, some of the things you have to be incorporating into your plan, like exercise is going to play a major role in that, in the quality of bone that's formed. The stress that you're putting on your bones, that healthy stress, exercise plays a massive role in that. But at the same time, you have to have the minerals, the nutrients, and all those inputs to help form that structure. It's a collagen protein matrix structure upon which those minerals are formed, but you also have to have the stimulus. So what happens with bone is you have these cells that are called osteocytes too. And the osteocytes, they're like mechanical signalers that say, hey, we've got stress that's being put on the bones, or hey, we're getting these tiny little cracks or fractures in the bone. That's natural for everybody, right? Not just people with osteopenia or osteoporosis. As you and I are going about our daily lives, exercising intensely and things like that, we're going to start to get these little tiny micro cracks and things like that. And these cells, these osteocytes say, hey, we've got these little micro cracks that need to be repaired. And then what happens is the osteoclasts come in, the bone resorption cells come in, and they scoop out those tiny little cracks. And then we have these bone forming cells that follow right in behind it and fill it in with stronger, healthier bone. It's a coupled process. And that is why it's so important to be active, because you have to have that stimulus to build stronger, healthier, better quality bones.
Mm-hmm. So it sounds like we should also add to the discussion of root causes sedentary lifestyles being a big contributor of this issue as well.
Absolutely. Absolutely. Okay. And I mean, I could even talk about too, mitochondrial function is super, super important when it comes to bone health. Mitochondrial function is actually, it's essential for maintaining your osteoblasts, which are your bone building cells, your osteoclasts, which are your bone breakdown cells, and the myocytes in the muscle. And what happens is when we have mitochondrial dysfunction, that's going to impair osteogenesis. That's the formation of bone we were just talking about. And it's going to increase osteoclast activity and accelerate bone loss. Part of the reason for this is when you have compromised energy metabolism and oxidative stress, that's going to contribute to age-related stem cell dysfunction in that bone. Mm-hmm. Mitophagy is also key in keeping the cell healthy, right? It's going to promote turnover of mitochondria, and it prevents that accumulation of dysfunctional mitochondria. And that in turn is going to play a role in the proliferation, the differentiation, and the function of those bone forming and bone breakdown cells. So we really need to be focused on how we can support musculoskeletal health. So there's plenty of research that suggests some of those things we were just talking about. Anti-inflammatory diet with plenty of protein, super important. Exercise, proper supplementation, vitamin D is important. Omega-3 fatty acids, even probiotics, can have a positive effect on muscle strength, bone density, and bone quality too.
Excellent. Okay. There is a myth that's been around for, well, I shouldn't say a myth. There's an idea that's been around for probably at least 3 or 4 decades, that consumption of protein, and animal protein in particular, acidifies the body, and that this leaches calcium from the bones. Are you aware of research that has tested that, and what does that research say?
Yeah, so great question, because I've heard this many times too. And protein is essential for bone health. You cannot, like when bone is being torn down or broken down, it's not like that bone is being, we're going in and we're selectively plucking out calcium from that bone. We're actually tearing down that whole structure, which includes the protein. So protein is so important. You cannot rebuild or much less maintain if you do not have adequate protein. So the absolute minimum amount that you would want to be including in your plan, and I mean like bare minimum, 0.545 grams of protein per pound of body weight. So if you weigh 100 pounds, right, 55 grams is, the absolute minimum. But what's unfortunate is, and especially, I see this a lot, especially with people that are following, and there's nothing, this is not like a dig or anything on that dietary approach on vegan and vegetarian, but I see a lot of times people are falling short, like really short there. They're not getting those nutrients and those amino acids that they need. So we need to be really, really intentional about how we get there.
And in many cases, they become actually fearful of consuming too much protein. Like for some of the ideas, there's ideas that consuming protein or animal protein might boost mTOR and IGF-1 and increase your risk of cancer, or is acidifying your body and causing your bones to leach calcium. These ideas have been circulating for many years. And so some people are actually falling short on protein consumption due to fear of consuming protein.
Yeah. And well, so let's even just talk about, there was a researcher at Tufts Nutrition Research Center on Aging in Boston, noticed that they did a study, and they noticed that a high calcium intake did in fact lead to increased bone gain if the patient's intake of protein was high, right? This was Bess Dawson Hughes. She had previously published the results of a calcium and vitamin D supplementation trial that produced a better than 50% reduction in fracture risk in healthy Bostonians. But there were some, like what you realize is that the people that had the highest protein intakes, so about 1.5 times the RDA, bone gain was dramatic in that group of people, right? So that's 0.8 grams per kilogram of body weight. And in the other group, it was 0 in the more than usual and usually adequate protein intake. So those lesser amount groups. So you have to have enough protein, but you also have to have the other nutrients that are going to be there too, because just enough protein is not going to be the only thing you need there.
Right. With that in mind, let's talk about calcium consumption and dairy specifically. This is another controversial area where, I mean, since you and I were little kids, we saw commercials on TV, saying, how consumption of dairy is so important for bone health. And yet, if you are in some of the vegan and vegetarian communities, you might encounter people who are saying consumption of dairy was actually linked with decreased bone density and things like that. And there are some studies that have shown things like that. So I'm curious what your interpretation of the body of evidence on that topic is as far as dairy consumption and bone health.
Yeah, I'm not a proponent of drink a bunch of milk. I'll start with that. I'm not a proponent of drink a bunch of milk, but I will start with dairy is a rich source of calcium, right? That's a fact. And a little over 30% of the calcium in dairy is absorbed. And if dairy is part of somebody's plan and dietary approach, cultured and fermented dairy is the kind of dairy you want to be incorporating. So that's your kefirs and your yogurts. And things like that, because you're not just getting those bioavailable nutrients, and it's more than just calcium at that point, but you're also getting beneficial bacteria, beneficial yeast too. Whey protein, if somebody can tolerate it, right? If you can tolerate that as part of your plan, that could be a helpful addition. But if you're somebody that has an autoimmune disease, or you're trying to improve some other health condition, you may test that and realize it's not going to be the right thing for you in that moment. But let's even just shift away from dairy for a second and talk about where else can we get calcium from that could actually be helpful for us. So we already know a little over 30% of calcium in dairy is absorbed. Edible bones are probably very similar to that, right? So that's your salmon, your sardines, your mackerel. You can go get canned fish. And when I say canned, most people are like, nobody wants to eat out of a can. Well, I can tell you those bones that are in there, they're going to be really soft, almost melt in your mouth. I know that doesn't sound appetizing, fish bones melt in your mouth, but they're not going to poke you. But what's great about salmon, wild sockeye salmon bones, sardine, mackerel is those bones don't just contain calcium. They contain all the other nutrients and factors and things like that your bones need in the right proportions. How perfect is that? It's nature's perfect food. And then we've got the addition of protein that's coming from the fish. And then we have omega-3s, the dampeners of inflammation. So that's an awesome one right there. Then we have 40 to 60% of the calcium in most cruciferous vegetables is absorbed, which is great. So that's your broccoli, your kale, your bok choy, arugula. Gosh, arugula is one of my absolute favorite leafy greens. And it is a great source of bioavailable calcium. If you're looking at, and I don't like plastic clamshells that are in the stores, but if you're looking at one of those and you saute that down into kind of a small portion, that's got about 200 milligrams of bioavailable calcium in it. And it's one of probably the last remaining bitter foods in most of our diets, which is going to be great for your liver health, for bile production, and for your digestive system too. So I absolutely love arugula. So if you can incorporate that one, go for it. And the other thing I like about
it's also one of the richest foods in nitrates, which allows for nitric oxide, which is critical for circulation and microcirculation. I've been kind of doing a deep dive on that lately, and microcirculation I think is critical for so many issues, and I am certain that it's critical for bone health as well. Interestingly, I will say that one of my go-to meals that I prepare for myself when my wife is not making much more elaborate and delicious meals for me is I take a big handful of arugula, just pre-washed arugula. I take a big handful, throw it on a plate, put some sardines on it, and put some, high quality dressing on it. And maybe, throw some leftover potatoes or something like that on there, or sweet potatoes. But sardines and arugula are like, for me, is a meal I have probably every other day.
Oh, that's a staple. Same here. Staple for me. Sometimes I'll use that Primal Kitchen dressing.
Yeah.
That could be a great one. I mean, it's easy
Hey,
too.
stop copying me.
It's an easy one. Like, if what I've realized is, like, you don't have to be perfect at this, right? As long as it's sustainable and you can make it work for you. Like, you and I are sitting here just talking about how, like, we both eat the same food almost every other day, and we have never talked about this before.
Yeah.
And it's easy, but it's good. Like, it's nourishing. So it's great. Yeah. So those are, again, going back to this, I'm not a drink a bunch of milk fan. There are great sources of calcium out there. If you're going to incorporate dairy, cultured, fermented, and it doesn't have to be cow's milk, sheep, goat, camel, like, there are other great sources that have less inflammatory proteins and even better nutritional profiles in some cases too.
Yeah, there's there's a company here. Right now I'm in San Diego. There's a company here that started selling some raw milk products at the local health food store, and they have a raw goat milk kefir that I'm in love with. Yeah. So it's like, many years ago, I used to go to like goat farmers in the area and just buy goat milk from them, because it wasn't even legal to sell raw goat milk. But now, fortunately, laws have changed. And so you can get raw goat milk products and raw goat milk kefir, and it's awesome and it's delicious.
I actually got, I got camel milk for our kids recently, just to try it out, to try it out and see it. And they didn't really know the difference. So that was good.
Yeah. I would like to get camel milk too. The only company I've seen selling it, it's ridiculously expensive for
it was
very
pretty
small
pricey.
Quantities. Yeah. Better be doing a lot of good stuff in my body for those prices.
I know, right?
So, what else did I want to ask you? There was one more question I had on something related to that. Okay, maybe I'll come back to it. So let's talk about what a bone healthy plan looks like, as far as what do we need to be doing on a daily basis or a weekly basis in order to maintain optimal bone health. Kind of take us through the list and some of your top strategies, and maybe throw in a little hack or two somewhere in there.
Yeah, for sure. Okay, so if we were to zoom out and look at a stronger bones plan, what does that look like? And this is the stuff I walk through in depth and at length, but I'll synthesize it down here. So the first step, you have to identify and address root cause issues of bone loss. If there are things that are damaging your bones or contributing to bone loss, you have to know what those things are. And actually, when you go get that bone density scan, remember, if you haven't gotten it, go get it. And then once you get it, that bone density scan is not telling you right now if you are still actively losing bone. So how do you find that out? Well, you go get a test called a serum CTX, or a CT low peptide test. It's a blood test. And that test looks at the activity level of cells that are breaking down bone. And if that activity level is really high, that can be an indicator of active bone loss and a root cause issue that needs to be addressed. There's also the NT low peptide and urine NTX test. You get the second urine of the day for that. So those are two of the bone resorption tests that you would look at, but you also want to look at formation too. And there's a test called the P1NP, procollagen type 1 N-terminal propeptide. It's the most sensitive marker for bone formation. And you always want to balance the two of those things and get them, at the same time. So that gives you a great picture, at least initially, of what's going on inside your bones at this point in time. Okay, so start there. Then you have to make sure you're getting the right nutrients to support, stronger, healthier bones. Through diet, through digestion, through absorption. You have to make sure that you're taking in the right nutrients in the right amounts, that you're actually absorbing those nutrients, and that those nutrients are making it to the cell level. All three of those things have to line up. And unfortunately, what I see even when people are eating healthy and they're eating, and they're eating and they're doing the supplementation stuff, they might not be hitting layer 1. So it's hard for the rest of those things to align downstream. So if you notice things in your own digestive health that are off, small intestinal bacterial overgrowth, candida, low stomach acid, or maybe you feel like you've got too much stomach acid, and some of those other indicators, then you need to do a little bit more evaluation there to get to the root cause of what's going on and address those things. And then we need to focus on building. You need to build strength of body, strength of mind, strength of bone, and you need to do that in a way that prevents fracture and injury. So building strength of body, exercise. Exercise plays a massive role in your bone health. You need 2 different types of stimuli for your bones. You need muscle pulling on bone, and you need impact. The most effective interventions are going to use one or both in combination. Okay. And what happens is you've got this mechanical signal that's sending a chemical signal that's telling those bones to become stronger. So a lot of times most people are told, hey, go do some weight bearing exercise. Great. Thanks. Walking, I can tell you, is not going to be enough, right? It's great for your daily health. I would say still incorporate that into your plan, but do not count that as your only form of exercise, especially if your goal is to improve your bone strength. It could help you maintain your bone strength, but it's not going to help you build really, especially if there's still something underlying. So do incorporate weight bearing exercise. By weight bearing, I mean anything that your muscles and your bones are working against gravity to keep you upright, right? Anything that's on your feet that's placing that stress on the bones, that's going to be good things. So running, jogging, hiking, gardening, playing tennis, soccer with the kids or grandkids, whatever that is, those are all weight bearing. And then also keep in mind, what are the non-weight bearing things that you're doing? And are those making up the majority of the activities that you're doing? Cycling, kayaking, swimming. Are those the only things that you're doing for exercise? Because those are non-weight bearing exercises. And that's not going to place the stress on the bones that we need. And it's not to say that just because those things are not placing the stress on the bones doesn't mean we shouldn't ever do those, right? If you enjoy riding your bike and it makes you happy and it reduces your stress, ride your bike, right? If you enjoy kayaking, I freaking love it, go do it. Swimming, all that stuff, great, but don't count it as the only thing. You have to incorporate the next thing I'm going to talk about, which is muscle and strengthening exercise, right? And you have to do it at an intensity. The studies that show the greatest effects are in that 5 to 10 rep range. That you have to do it at an intensity that's actually going to have the desired effect that you want. So this would be, you could use heavy resistance bands. You could use free weights. You could use, barbells and things if you know how to use those things. And the major compound movements, the squats, the deadlifts, the overhead presses, those kinds of movements, those are movements that are really going to be helpful. Now, just from this conversation, if you don't already know how to go do those exercises, please do not go to YouTube, watch one video and go start cranking out 5 to 10 reps of deadlifts. Please don't do that, right? Probably not going to be the best thing for you, but get something to look at your body mechanics, evaluate your movement patterns. Then once you do that, you'll be off to the races there. So that, and then the other thing is sleep. You need to sleep well. That's the time for your muscles and your bones and all these things to repair. And it is pretty well documented. If you have poor sleep, it will reduce your bone quality. So that's one of the biggest things that you can do is start getting some better sleep.
Beautiful. Last question. I actually remember the one that I want to, 2 more questions. I remember the one I wanted to ask you before. Are you aware of any research around stem cell activity and bone health? Is there a link between doing things which are stimulating the release, the proliferation of stem cells and maintaining bone health?
I actually just did an interview on this recently with someone where we talked about stem cells and bone health. And
Cool.
While there aren't any human studies yet, there were some promising animal studies that show there may be some benefit there. I think more research is going to have to come out on that. And obviously, just from this conversation, I can't make a statement that, that's going to be an effective intervention for that. But at least from a clinical perspective too, I think, it could be helpful, but we don't know yet.
Got it.
That's probably the safest way to answer that question.
Okay. And the last question I have for you is, are you aware of any sort of more advanced technologies, things like red light therapy, things like pulsed electromagnetic fields, or anything along those lines that has been shown to be effective in helping bone mineral density?
Yeah, PEMF, Dr. Pollack, he's one of the leading people in that whole vibration plates. A lot of times people come to me and they ask me about these different modalities, vibration plates, like the power plate or a Meridyne or something like that, or the PEMF mat. And those things can be helpful and they can be a complement. But a lot of times people start with those things and they come to me and they say, hey, I got this single supplement, or hey, I got this vibration plate. And I'm like, great. Do you know if we have we addressed your root causes? Right. But we're still having, diarrhea every day, or like we're not sleeping at all at night. I can tell you that the investment you would make in those things is not going to do what it's intending to do until you get the other pieces in place.